Seeiso, our Minister of Health, that is Starlight, Her Excellency, May I call His Grace, the Archbishop, that is Tebello, all of these dignitaries who are amongst us today. We thank you for being here. Bana, I will talk it in the two languages, Lesotho, Sefoa, English, Lesotho, to accommodate all of us, to make sure that everyone is catered for in this special event. This is the official launch of the Starlight Oasis of Hope Hospice. The hospice started back in 2017 as a brainchild of the daughter of our soil, Malichaba, who's amongst us today. This is the reason we are gathered here today, to launch this great initiative, which you will hear more about it as the program progresses. Before we move any further, I wish to call upon His Praise, the Archbishop, that is Tebello, Behela Amadea Mabao, that over Tebello House, Tebello,
let's call upon the author of life. Almighty God, the most precious gift you have given us as human beings on this earth is definitely life, love, the time that you have given us. Today, we call upon your blessings on all of us here gathered, and to this kingdom of Lesotho for such a noble undertaking to have indeed a hospital of hope, 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 where people will help, hope, people to excel, to even live in a better life. We never present our prayer, Lord God, we want to thank you for all the health care institutions and the palliative care institutions that are formed throughout the world for the work of recreating human beings by their service to meet the needs of the people regarding their health, to heal and prevent diseases, heal wounds and injuries, and all kinds of pain. Thank you, Lord, the giver of life, for these institutions. But also for the doctors and nurses who commit their lives and use their skill, their ingenuity, training to restore health and wholeness in other people. Thank you for all these inventions and discoveries in the field of medicine and pharmaceutical facilities that have helped enhance life today. Lord, grant us help and all our blessings day after day, and bless those who are now present in a special way. Bless the founder of these, indeed a home for the people who are indeed tormented by diseases, cancer included. For all these, Lord, bless and make prosper this hospice. In the name of the Father, the Son, and the Holy Spirit. Amen. Amen.
Starlight, re a utlwa ha re ithuta history hore e nngwe ya dikopano tsa kereke ya hao e leng the Sisters of Charity ke bona go pula madiboho ditabeng tsa palliative care. For us as a country, we don't have this service for our people, so it's very important, it's very treasured, valued, and appreciated that we stand here today launching this initiative, which is going to offer what our people desperately need. Over and above that, this is in convergence with what is being done by our Ministry of Health. As we speak, we know that under the non-communicable disease and for cancer-related issues, they are in the process of building the radiotherapy facility. We are pleased to know that, and we hope our people will be encouraged to know that as well. We also are aware that this very year, a month ago, our first patient was given chemo right here at home. These are milestones, and today we launched this hospice here. All of these things converge and encourage us, and we hope they encourage the affected. And I guess we are all affected directly and indirectly. Having said what I've said, I also wish to call upon the CEO and founder of the Starlight Oasis of Hope, Mayor Malichaba, Lepheane, As she stands up, I wish to share with you that Malichaba ke Mosotho ya ileng a tsamaya o ile tsomela bana le tuntsunyane kwana mose ka tshebetso ya hae ya booki. Ha le mo a ileng a ba le kgahleho ya hore a ithutele ditaba tseo tse ntse re di bitsa tsa palliative care. Mme ebile yena mooki wa pele hae mona nna tsebong ya ka ya bileng le lengolo la tshebetso ya mofuta o jwalo. Empa re thaba ho tseba hore se re na le ba bang. Mme ke kopa o eme o tlo bua le bomme le bontate ka leboha.
Good afternoon. I wish to align myself with all the protocol that has already been mentioned. As it's already been said, I am Malichaba Tebello Lepheane, but those that grew with me, they will know me by Tebello Maswadi. I was born and raised in Simongo by my grandparents. I'm the only child of my parents who sadly and unfortunately left me with a sudden death just a year apart. My dad, that was in 1999, he collapsed when he was supposed to go for funeral back home in Simongo, and that was the story. A year after, it was my mother just left my home. An hour after, I was called. She and the other multiple people were run over by a car just not far from where we are, Seeiso. And this was a journey indeed, a journey of soul, indeed a journey of spirit, soul searching, which I thank God Almighty that has brought us today to see this day, because it has been a torment and a burden in my heart. Because from that experience, it became indeed an appreciative moment for me, day in and out, to value the time. The time that we all treasure, and each one of us has 24 hours in it, in a day. A time that when it's gone, you can reverse the clock. A time that is so precious that we all share. And I'm grateful to Almighty that we can share this moment. As I mentioned, that became a soul-searching moment. God pulled me out of the distress and the grief and gave me hope. And when he gave me hope, I took a deep dive in his word. And it was along those journeys, an encounter and personal space that I had with him that became a clear revelation to me. Because he brought a vision time after time until I was confident enough that this is something beyond me. I shared it with my husband, which he is here amongst us today. And I'm grateful. I have got no words when it comes to you. Thank you. I wish to just ask him to rise up, just for you to know him. He's been part of this journey. He's been part of my cries and my laughter. We are blessed with the 2 children. One is 25, one is 20. They've been part of this journey for a very, very long time. As I saw the vision had a lady. This lady was living in a small hut in one of the far-to-reach places. She was lying there in a desperate situation. She had no food to eat. She had no medication to address her pain. She was debilitated by suffering, and indeed, she was desperate. I didn't see any husband around her, neither a child, neither a neighbor. And she was there, desperate to have something to eat, nothing to cook, even if the one was to stop by. And then I really got this message loud and clear, time and after time, that there are many people suffering in distress with cancer in your kingdom. You carry the harvest and take it home. I was terrified. I didn't know where to start, how to start. Pockets not enough to do anything, just to manage my family and keep them comfortable. That's all I had. And honestly, I'm grateful because so many people, many of them are amongst us, that have been part of this journey, that have been there in prayer, in support, in mentoring, in guidance. And one of them that I met, as I was really desperate and didn't know how to start, the vision couldn't allow me to rest. I couldn't sleep. I was restless in my soul because the time was ticking. I was running away from the vision to start a hospice, as it was what was mentioned, that such people who are desperate, needing health care, needing their pain to be alleviated, needing social support, spiritual support, and the holistic care that palliative care talks about, are there desperate in your kingdom, and do something about it. I started the journey and registered the organization in 2019, and I realized as soon as I registered that even if I was to sell all that I had, I would still not be able to deliver the care to every Lesotho who is suffering of cancer. I approached the office of our British High Commission. Fortunately, we have got Mayor amongst us today. Mayor, thank you for your time, for your promise, for your guidance, and for your love, and for your care for this kingdom. She didn't really think I was just somebody who is just wasting her time. She really gave me information that has shaped the registration of Starlight Oasis of Hope in the United Kingdom. And honestly, thank you, everyone. You know yourselves that have been part of this journey. I will end up making a mistake by mentioning some and leaving some. Let me just stop here. You know yourself, and you know where you have been with us. You know how you have helped Starlight to become what it is. You know how you have helped me as a person to get through the challenges of disappointment, delays, frustrations, oppositions, and everything else. But I want to honor my Ministry of Health. Ministry of Health has been so welcoming. 2017, I entered their doors, desperate, restless, as I mentioned. My husband paid for the air ticket, and he says, me and the children, we are losing our peace in the house. Anytime the cancer patients that you are affiliated with, when they call you or they send messages of their distress, or their family members connect with you and let you know that they are now terminal, that they have now passed away, you are always crying. You can't bear it anymore. You paid for the air ticket. Go and register, and let's see what the Lord will do. I came as a woman with an empty pocket, only the money to feed my family. I entered the offices, booked an appointment. Luckily enough, I got an appointment in 2 days. I came, I saw the minister at the time. The message went to the ears that I believe God had prepared for such a time as this. And the message was conveyed to the other offices that are in the decision-making capacity. The very same day, Mayor was supposed to be holding the meeting. the very same time I was in the office of the minister. I was taken and escorted to her office. As the people that she's supposed to meet were waiting outside for the minute to tick for them to enter, the message was given to her to see. May did not say tomorrow. She did not say I already had a meeting booked. May just asked and apologized that she just needs to listen to the message that I'm asked to convey to her. That is how the journey started. As we stand here today, we have got a memorandum of understanding with the Ministry of Health, as we acknowledge that there are gaps that exist in the care services that we deliver as the kingdom to our people with life-limiting illnesses, to our people with life-threatening illnesses, cancer specifically. We are quite aware and appreciate the efforts that the ministry have done. They have been working tirelessly, being pushed from side to side during the seasons of infectious diseases. We know how we have suffered as a kingdom, as a nation. During the communicable diseases such as TB, such as HIV and AIDS, as we are now, we are wearing the mask for the simple reason of a communicable disease that exists during our lifetime. And we know the resources that are limited, the resources that will be pulled out and fast-tracked to address this communicable disease. And I guess we'll appreciate why there's this big gap in our healthcare services that exists when it comes to non-communicable diseases. Because communicable diseases demand urgent attention and demand all the manpower and the resources to address the issue straight away. And we are here with all our gifts, all our talents, all our time, that we can do something and contribute. As Medino has mentioned in her statement, we have got a role to play. We all have a part that we can do in order to bridge the gap that exists in these challenges that exist in our lifetime. I wish to appreciate everybody that has taken time out from your busy schedules to be with us today. I wish to honor and respect all the trustees back in UK and in South Africa that really donated their time and skills. And when I shared the vision with them, they didn't say I was just a mad woman who wants to change a nation when there's still a ministry that exists, when there's still the government that deals with the health issues. They listened with compassion. They listened with a love for the people, and they did their best for us to journey together. Following the guidance of Mayor in 2019, I struggled to get the trustees back in the UK, but in the end, there was a breakthrough, and we were able to register Starlight Oasis of Hope. We have got medical doctors back in the UK, many specialists in the healthcare sector who have got such a burning heart to come and share their knowledge and time with us. I wish also to appreciate the Basotho Diaspora Association. We have got this association, which I believe most of us have been aware when it was launched. And among us, we have got the president and the treasurer. Can you, Hadio and Dade, Dikapa, just rise up for the people to see you, please? This association indeed just started, but through it we have been many times encouraged as Basotho to actually invest our time, invest our talent, and invest our treasure back home and make a difference with what we fought wherever we are, wherever home is away from home. And it is indeed an honor that I have been able to get all the support I got here at home and back in UK to make this a reality. And I appeal to all the stakeholders, our Ministry of Health, the cancer associations, and everyone involved in this health space, that can we please work together, collaborate in every way possible, forget about ourselves and remember that woman that I spoke about. Because not just that woman, there's still one gentleman in another corner suffering, lost the job because he's got cancer and can't bear the pain and suffering, and the income for the family drops and the family struggles. The children lose the chance to go to school, no school fees. Also, let's remember, there's one little child somewhere suffering, just born into this distress of being called a cancer survivor or cancer sufferer. There's a youth somewhere in another corner that is struggling to actually manage her life, to have continuity of their studies because they are suffering of cancer. They are in and out of hospitals. They miss out on the play with other children in their age group. They miss out on their studies, and they have got no access to study at home while they are in hospital or at home still trying to recover after their treatment in Bloemfontein. So we all need to work together to address this gap. And indeed, I believe this is just a continuity of what is already existing. We are just reminded and challenged by this launch that we need to do more to serve our nation. I'm grateful. May Her Majesty, Masenate. Thank you. When we approached you, that we have got this initiative, you looked into it and accepted to be our patron. We want to honor you and thank you unreservedly. We will not disappoint you. And I thank God Almighty, the giver of life, the giver of our breath, the one that gives us light and day, the one that has created all things, that He has honored us through your grace and the grace of your office, that we were given this space. Because indeed to us, it's a challenge and appeal, and it's a great invite to always honor your name by delivering the best of what we can with the best of what we have, and we will do that. God will help us. I want to honor all of you and thank you. Thank all the trustees, the community back in UK, the prayer partners here at home and back in UK, my family, Lepheane family and Masabi family, and all the families related. I want to honor all my neighbors, I'm grateful. Let the Lord guide this day from here. Pray for us that we do everything accordingly, that it is not just the words, but let the delivery be felt by the Lesotho who needs palliative care, who needs hospice, who needs the physical issues to be addressed, their social issues to be addressed, spiritual and social. My dream is that one day, when we continue to deliver care, that the collaborative efforts between us and amongst us, with all the relevant stakeholders and ministries, that within a click on the computer, Lesotho can receive the best care get referred and seen on time to study and grow well. I want to submit and surrender all that I have just said to Almighty. Let Him only get the glory out of this launch. I thank you.
You did not go to the United Kingdom for yourself alone, for your family alone. You went there for all of us, and we are appreciative as a kingdom, as a nation, for what you have brought back for all of us. It is appreciated. Ka mora mona bomme le bontate mme o buile ka batho ba hlotseng kgodumodumo ena e bitswang mofetsi ba teng hara bona mme ho hlophuwe kajeno hore ba tle ba eme le bona ba fane ka lentswe ka baka la nako ke a le mong wa bona ya tla fana ka puo empa ke kopa hore pele ke mo phahamisa ba eme re ba bone re ikotla sefuba ka bona ke kgothatso ya bona hore ho ba bona ho tseba hore taba ena le ha e le boima hakana e a lwaneha monyetla wa bophelo o ntse o le teng re ne re ka rata ho utlwa leeto la bona tseleng ena ya ho lwana le boemo bona empa nako ha e re dumelle re na le mme Majakote ke kopa o elelle re na le mme Chaka mme Mata re na le ntate George re na le Ausi Ho ya le bua bomme ba ka le ka dula fatshe wena Ausi Ho fetela kwa. You've been chosen for the simple reason. Sometimes we tend to think that certain conditions affect certain ages or certain gender alone. Also, Dimpo, young as she is, she has been through this ordeal. She's going to give her own speech and share with us part of her journey. Also, Dimpo, thank you.
Thank you. I would love to align myself with the protocol that has been set already. Lebitso la ka ke Dimpho Mohale, ke dilemo di 20. I survived cancer in 2007. I was 5 years old. It was neuroblastoma, which is a very common cancer in kids. It's a kidney cancer. So I lost a kidney to cancer. Since then, I started to get Palliative. So, I was a kid, yes, but I'm not from a very fortunate family, so also the information about cancer wasn't, so creating like it's happening before diagnosed. So I was diagnosed at stage 4 with cancer. It was worse. So after the surgery, I felt like I was very special. I went to school, primary level. I could tell everybody that I'll have another kidney. just so that I could get that attention. So whenever people were like, whoa, I'd be like, yeah, no one is like me in this house. So yeah, it was good the first times, those days, until I got to understand what was really happening with me. Grade 4, class 4, la go se di primary school ha se a bonolo motho a tseba se gwa ha ka nako etseno, and le confidence ya o shebana le magoa ai no so biti. But ka grade 4 ne se go utlwa se ke gona go kwa dingaka ha di bua ona go etsahala. So la go se sa go motho ha fihla sepetlele o tla kenywa di go etswa di research ka bo madi ding. So cancer etsa motho a be weak haholo ka gore e thola sesole sa mme. So pretty much everything ela check ka nako yo ela fungwana. Diabetes, you can call them. HIV, you can mention. So grade 4 ke hotse ke bona ntse ke nwa dipidisi fela ke setse nna ke tsang, and nako yohle ha ke botsa mme o gosh o natla nyetsa fela you know tonight over your life journey, so o tla me o dula ona ntho tsena gore o no o be le strength nyana seno. All right, I understood bana kukusa ehlile if ha ke sana phio engwe ha ona mo engwe e tlomela teng. So maybe yeah, until I found out hore ke di ARVs. All right, that I was confident hore ha ke na kidney engwe, but till then hey, things changed. Ka ukwa ka se ke fuwe mogolo o nkimelang haholo. I could not cope. So ke ne ke le ngwana bohlale haholo sekolo, very clever. Position 1, 2, 3 ne ke lla go ke lla tse monana. So ho tloa ka nako eo ha se ke utlwisisa e be sentse ke nagana le taba tsena tsa okay, jwale ehle ha ke na kidney, what's going to happen with me? Since ke kwa gore kankana ke HIV, okay, it's fine. HIV since na le dintho tsa teng tse sentse di sebediswa. So me not having a kidney laba a very bother to me. Hobane ke sa utlwisisi na what's going to happen to me in the end. Ntse ke na le bophelo after this kapa go sona le khutsufatso nyana e se etse. I've always been a very confident person, so I trust my doctor alone. Is there any life? How much time do I have left? And he said, no, you have time. You actually have time. So an outline is that you need to take care of yourself. Taba ya hospital kidney ya hindara ho etsa dintho tse ding. So I understood, but ke sa utlwisisi na how is this going to happen? Hona le di complications tse etsahalang after surgery. I can't stand for too long, I can't sit for too long, I can't lie down for too long. Hobane mo no mo phio e leng teng wa opa ha ka etsahala ntho engwe le engwe haholo. So ke sentse ke ipotsa okay, hantse ke hola ne ke sa utlwe ntho tsena, but with time I'm feeling these things. At some point worse. I thought about such things. So before I went to high school, yes, so I got to a boarding house. I had to adapt to that, to the life there. The conditions weren't so favorable. So I met friends there, and for the first time I got a reaction that was very, I did not expect that. I would always tell someone that I lost a kidney to cancer, and then they just go like, whoa, but that one was, she freaked out. What? And then after that, she even left. She was like, I can't do this. So it broke me. It broke me. I was very disappointed, at the same time very lonely. Well, my studies dropped very, very much. I could just go for positions like second class, But at some point, I made peace with it. I suffered a lot in my high school days. So I really did not enjoy my high school. My childhood wasn't very pleasant. So I thought to myself, okay, why am I suffering? Why am I the only one in this family that I live in who's got this? Is there a purpose for this? So I thought it through. I thought that, no, it can't be me alone. There are some people out there who are probably going through the same thing. And 2020, I approached Majesty, December. I also had an idea of building a foundation, which is now just emerging. Yes, it's the Trustees Care Foundation. So I'm very happy that I met Lepheane because I feel that we need to connect. The fact that we're not given so much recognition as cancer patients make us feel like we are left out a little bit. Because, I mean, I never get to be Lepheane is a lekanako. Mohlomong ho ja lentswe nana la cancer le ne le anetse hohle. Ho ka bo ho etsetse hore mohlomong nakong tseo ke le ka tseba hore nka tresa mang. But I had to go through that alone. So I also felt like ha hona ntho e ntse e tsuwa. So I'm very, very excited hore ke bona hore hona le program e tjena. I only knew about it just a few weeks back. I was like, okay, so ehlile Basotho ho ntse hona le batho ba interested in empowering cancer patients, survivors, and people around them. Most people don't know about cancer. They just, I have cancer since I know she's dying very soon. Or we have people, Banseba, bailing the patient. I know a woman, she's between 58 and 59. She has breast cancer. Since 2019, she knows she has it, and she's been diagnosed. But because of the ill treatment that she got at some point, she can't just talk about it. So we need to talk more about these things. She's not comfortable. She can't go out there and talk about it. She's always in her house. I think she's just waiting for her time. That's what she said when I asked her. These are the challenges that we face. It's not just about the youth. It's also about the women. Women have their families. So after cutting a breast, I think the confidence goes down. She can't face maybe people around her, her family, you know. And most times, the family members are not even given counseling or maybe taught about how they can best approach a patient. So they just do what they think is best, and sometimes they're wrong. Yes. Well, for the youth part, I felt that if I don't stand, then I don't know who will stand. I have to stand for my youth. I am the future generation, so I have to empower youth. Thank you.
What can I say? How simple, realable. Malichaba, realable. How simple, umofile tshepo. By launching the Starlight Oasis of Hope, yes, indeed, we are bringing hope to many. We're bringing education to many. And thank you for sharing your story. Stories are always the best way to teach. They stay with us in our hearts, in our minds. We will never forget that day. We had a story from a young person called Dimpo, telling what she went through in her own journey. We are grateful. Thank you very much. Okay, thank you. Poso e tsamaya le mohatisi. I don't know how to say that in English. I wish I could say it. I realized as I was calling Austin Port to come to the stage, I skipped a speech by Dr. Paul. He's not here with us, but we're going to hear his speech. These are some of the people who are behind Starlight, supporting in kind with their professional skills and experience. Dade Paul, to mention but a few, he's been to the Mountain Kingdom for the past 12 years. He's been in the area, training in the area of mental health. He's also been training in the area of palliative care. So he has a lot that he has offered this country. And now we mention him again as one of the people who are behind Starlight. I think we will just listen to his speech. Dade Notwani, you may proceed.
Excellencies, distinguished guests, friends, Tebello, thank you so much for joining us today. My name is Paul Myers. I am the chair of Dom Cymru Lesotho and also privileged to be chair of the trustees of the Starlight Oasis of Hope Hospice. It is indeed a great privilege to speak with you today at the launch of Starlight Oasis. I am a retired family medicine practitioner from Wales in the UK with an interest and experience in person-centred care, mental well-being and the effective delivery of healthcare internationally. I have visited Lesotho on several occasions over the last 10 years. And during those several visits to the wonderful mountain kingdom of Lesotho, I've witnessed the dedication and commitment of healthcare workers across the country. I've listened to their concerns and needs. Many have told me of the difficulties they have caring for people with life-limiting illnesses. Many have told me of being unable to provide adequate pain relief in individuals approaching the end of life. Therefore, Lesotho are often suffering unnecessarily, and there is a lack of confidence in managing some of the symptoms in those who sadly cannot be cured. The World Health Organization has recognized the importance of palliative care and that it should be available to all those who need it. I have been inspired by the commitment and passion of Mayor Malichaba, Tebello, Lepheane, as she has assessed the need and scope for palliative care in Lesotho. She has advocated on behalf of all people with life-limiting illness and has brought us all together here today to show our support for the delivery of palliative care services in Lesotho. Thank you all for the support you have given, and of course we hope you will continue to advocate and support us in the future. We plan to start training early next year to give the necessary knowledge and skills to provide appropriate and effective care to frontline health and social care workers, giving them confidence to respond to the needs of those with life-limiting illness, and bringing to them and their carers relief. Next year, we will form a palliative care team in Masenate to provide advice to care workers about individual patients and help problem solve. During next year, we will open a small day centre to provide direct care to individuals who are mobile and visit individuals with advanced disease to ensure that they are as comfortable as possible in their own homes. This service will expand as more individuals are trained and as resources allow. We strongly believe that all health workers can deliver care to people with life-limiting illness. All want to relieve suffering, and we will demonstrate that the necessary skills are easy to develop. We will advocate for the right treatments to be available. Many are already being used, and many are not costly. We will show how to use treatments safely and cost-effectively. Our intention, once there is the knowledge to care effectively, is to build a hospice, a comfortable, dedicated facility for those who cannot be cared for at home. This will aim to relieve symptoms, enhance the quality of life, and ease the burden on families, and will also enable individuals to return home with packages of care and better symptom control. That is our vision. That is our plan. I am sure all of us wish to be assured of good care for our families and for ourselves. Starlight Oasis cannot do it without your support and the involvement of care workers, local officials, employers, church leaders, and families. I wish you all well. I'm sorry I can't be with you in person today, but I'm very proud to be part of this launch and look forward to the success of the future care to the people of Lesotho. Thank you for your attention.
Thank you very much, Dr. Paul. Ho bomme le bontate, ntate Paul ke motshehetsi wa morero ona o ntseng re re ke Starlight Oasis of Hope. E tla ba setsi seo batho ba imetsweng ke mafu hara ona a tshwanang le mofetshe a sa tshwaetswaneng ha ntse re non-communicable diseases ba tla fumana tlhokomelo teng ho ba imolla mahlokong a matla a tlang le mafu a tshwanang le ano, empa ha se tlhokomelo fela ke tlhokomelo e shebileng mafapha ohle a bophelo ba motho bo botle, ditaba tsa hao tsa moya, ho kgotsofala maikutlong kapa ho se imelwe maikutlong, ho tseba ho hlola mahloko kapa boima bo tlang le bohloko ba lefu le ka bang le ho beile tlasa kgatello e jwalo ka nako eo. Ke seo Starlight e tla se etsa. Sebaka sena se nahanetswe ho ba maqhaka pele o tla fihla ha bua sono, pela moruku o ha o ya ha bua sono o hlama serumona ka letsohong le letona. Pela difate mo ha o bone ha o tsamaya tseleng fela o potela ka mono setsha se hona mono ke hona mo taba tsena di tla etsahalla teng. Jwalo ka ntate Paul a tjho setsinyana se sekalo se keke sa netsa tshebeletso tse jwalo naha kaofela. Matsoho a lona le ba bang a hlokahala hore tshebetso e Starlight e tla beng e etsa e anele naha kaofela. Amongst other things, Starlight is going to offer training on palliative care to professional caregivers and to home caregivers, informal, because in our villages, cancer doesn't know a rural village. People are suffering, so we need everyone, formal and informal, professional and non-professional. So this hospice is going to give skills for people to care for others in a holistic manner, as the word palliative care means. And I hope you'll go tell the National University to help us. I don't know what palliative is in my language. I wish we can find a word so that my fellow Basotho, palliative, and thank you for the support, Yabondate Paul. At this point in time, I'm going to call upon the speech by the representative current and potential partners and collaborators. I wish to call upon Attorney Seeiso Sello Mafate. May, please.
Allow me, Madam Program Director, before I can align myself with all protocol, to say warm greetings to His Majesty, the King, Letsie Laboraro, Her Majesty, Queen Masenate, Me Dumedisa. The Right Honorable, the Prime Minister, Dr. Mweketsi Majoro, the Honorable President of the Senate, the Chief Justice, Justice Sakwani, and judges of the High Court, Honorable the Deputy Prime Minister, the Honorable Ministers and Honorable Minister of Health here present, Ntate Dumedisa, Their Excellencies, heads of diplomatic missions, international organizations, international charitable organizations here present, and I recognize and pay my respects and warm greetings of the Mountain Kingdom to Her Excellency Mayor and Macro, the British High Commissioner, Mayor Dumedisa, the Chairperson of Starlight Oasis of Hope Hospice, Dr. Paul Mayers, the Chief Executive and Founder of the Palliative Care Hospice that has made all of us gather here today, Mayor Malichaba, Tebello, Lepheane, the Lepheane family, Ntate Lepheane Libana, distinguished guests, and I recognize also as well the presence of the Director General, Dr. Nyani Litsie, and all the Honorable Principal Secretaries and Deputy Principal Secretaries here present, friends of the Starlight Oasis of Hope in Lesotho, the SADC region, the United Kingdom, the global partners in all their forms. Re ka bua ka dikgwebo, re ka bua ka di-foundation tsa malapa, re ka bua ka mekgatlo ya boikopanyo, ka mekgahlelo yohle ya bona. Our cancer survivor, Ausi Dimpho Mohale, and all the cancer survivors, and also who are dealing with all these forms of debilitating sicknesses and illnesses. Basotho bohle ba phelang ka hare le ka ntle ho naha, bomme le bontate, batjha bohle. May I stand here before you with immense and profound gratitude and say that journeys of hope are about consistency. That journey of hope that Malichaba dreamt of, and which today is being celebrated, we can only say that that journey has not ended, because each journey brings in more journeys of hope. Standing here today as one of the partners and representing all the partners in this honorable and noble initiative in the space of palliative care and also the hospice. May we, I plead with the Basotho nation especially, and now as I switch tongues to speak in Sesotho, and say to all of us here gathered, ke kopa ka hlompho le boikokobetso bo mme le bontate ka mekgahlelo yohle ya lona ya setjhaba ke qale ka lona pele. Ke a tseba ha se ntho e tlwaelehileng hore ha re tlile mesebetsing e ka reng ena hangata re bitsa hore re tlo kgakola, empa ke tla kopa ho sa tlwaelehang hore re be mehlala ya pele ka mona. Ho na le sefela se ke se ratang haholo se bitswang Song of Courage. Se na le mantswe a latelang: give back to him, re bua ka Morena Modimo, mmupi wa rona. Se re give back to him what he gave unto you, talents and all the beautiful things that you own. Ha re le ka mona kaofela ha rona re na le ditalenta le makgabane. E mong le e mong ha tsebe hore in a charitable space ho na le seo a ka fanang ka sona. Mme bomme ba teng le bontate ba dutse tafoleng mane. Ha re ke re be mohlala wa pele wa di-pleasures, mme Madimo mo dutseng teng a ko bone hore o bua le bomme le bontate ka boitlhompho, o bone hore ba sia mabitso a bona molemong wa hore jwale tjhelete e tletsebe hore e kene e tlo atleisa mosebetsi ona hobane e se le ha re qadile. Ha re ke re be mehlala e metle pele re ka ya bua le bane be re buileng ka bona re ke mekgahlelo e mengata ya setjhaba. Re se re bua ka batho ba batjha hona jwale. Ha re ke re etseng bonnete ba hore ha re fihla malapeng mane ditaba tse re di fumaneng mona re ke re be dititjhere tsa pele le matitjhere a pele ya ditaba tsena re ke re di tshwaele bana. Re ithuta ka mehla hore ha o bua ka di-charitable organizations re tla be re bua ka di-foundations tsa malapa bo mosekwana hore ba file Lesotho eng. Ka nnete ke a ikokobetsa ke utlwile dihlong tse tshabehang hore re dula re amohela fela re opa matsoho fela re sa rena hana rona re ka fana kang. Ha re ke re boneng hore di-lunch boxes tsane tse re di etsetsang bana ba rona, nna ka nako ya ka bana ba ka ba sa le banyanyana ho no ho ntso ho na le hore ho thwe re ba fe diranta tse 5 ho thwe ho etswa fundraising sekolong mane tsa Malodi. Ha re ke re qalelleng bana ba rona re ba ruta hore jwale ka ha ho so etswa taba tsena tsa digital learning e re pele a tla qala mosebetsi wa hae o mmotse hore na hana tjhelete ile kileng ka o fa yona pocket money e ileng diranta kapa 5 maludi ke kopa tshwarelo 5 maludi o ko e fitise ka marangrang o bone hore e kena ka hara morero ona o re beileng mona letsatsing lena la kajeno. Mme ha ke se ke buile jwalo ke fetele mekgahlelong ya bahwebi bohle ba teng ka hara naha ka mekgahlelo ya bona kaofela ba banyane le ba baholo. Please, I plead with you, let's make it a lifestyle to give. Let's also teach our children to give. Let's also teach our employees to share and to give. Let's adopt and schools, and then here is the hospice that our companies in all their different forms can say that rona le hae lena la hospice le ditshebeletso tsohle tse fanang ka tsona re tla bona hore re a le haha. Mme ke tla phethela ditaba tsa ka ke utlwa haholo ke tlameha hore re hopotsaneng ka ditaba tsa Agenda 2030, but importantly Agenda 2063 of the African Union. Ka nnete we are exactly 4 decades away. Ha re kope re le Basotho hore ka 2063 ha re etsa diripoto tsa rona ebe re a qalella hape re ntse re tlo tshwaela re ntse re le tlase mane mohlomong ha ene ba re bua ka diperesente re ntse re le ho 5% ho anetsa tlhokomelo e holistic ya kakaretso ya ditaba tsena tsa palliative care in the kingdom. Mme ke qetele ka ho tshwaela ditabeng tsa digital health. Digital health e bua ka tshebediso ya marangrang ditabeng tsa bophelo. Mme re sentse re bona Starlight Oasis of Hope Hospice ke ena ha re sebedise marangrang ano ho bona hore ditshebeletso tsa palliative care di fetela setjhabeng. Ke a leboha, ke a ikokobetsa. Modimo a boloke Lesotho le Basotho.
Re a leboha mme, re a leboha ho menahane. Ke kopa ho kadima mantswe ke utlwa a sebediswa ko wena ntate Mobabatsei. O tlwaetse hore nobody's too poor to give. Ke utlwa ekare mme o tjho jwalo kaofela re ka fana. Mosebetsi ke ona ha re faneng. Ke a leboha, re a leboha mme ka molaetsa o matla. Ke kopa ha re le mothating ona re ke re fumane lehlaso. Empa ho lehlaso leo ke kopa fela ho ananela boteng ka hara rona ba President of Starlight Oasis of Hope, Professor Walter Jones is amongst us. We wish to recognize him. Now, we are grateful that your presence amongst us on this occasion means a lot. We appreciate. Thank you. At this point in time, we have a group from far away, from Semonko. I'm sure you're wondering what you're going to hear from people from Semonko. You're going to be blown away. We wish to call them on board to come and give us some entertainment.
Thank you.
All the powers, I would say, Enko me macro, we have adopted the English when we've had something very nice that we enjoy. We've adopted the English, and when you say Enko, we mean it should be repeated. And at this point in time, oh, thank you. At this point in time, before I call you, May, this was meant just to break the ice and make all of us laugh. I wish to give this opportunity to the IT people to help us play the speech by Mayor Joan Marston. You'll hear from her speech who she is. Go ahead, Nadeno Don. You don't have it? Okay, it's fine. Mayor Macron, Our Excellency, please come over, Mayor, and give us a few words. Thank you.
As long as I'm not expected to sing and dance.
You can say encore. They will come back. Thank you.
Thank you. Before I begin, please let me pay my respects to His Majesty King Letsie III, Her Majesty Queen Masenate, and in the interest of time, particularly since I know we have cancer sufferers here who find it difficult to sit for a long time, let me associate myself with the protocols already observed so that we can move on. Thank you so much for inviting me to be here this afternoon now, for the launch of the Starlight Oasis Hospice. This is something which I think is very much needed in Lesotho, so I'm delighted to see it finally coming to fruition. I first met Malichaba, I think in 2019. We'd just reopened the High Commission here in Lesotho. In fact, we didn't even have a building yet. I think we met at the hotel where I was staying at before we reopened our building. And she talked to me with passion about the vision that she had and what she wanted to achieve. I think I spoke to her about the importance of registering in the UK and gave her some details of people that she might interact with. And then I confess I thought very little about it. This was just one of a number of people who had come in those early days, and we talked about plans and we talked about Lesotho, and then COVID happened and the setting up of the High Commission happened, and we were very busy. And as I say, it wasn't something that really crossed my mind again for a while. Until about 6 months ago, as she came back and she said, "Mate, I've done it. I have registered in the UK and have got patrons organised, and I have interacted with people in Lesotho to find sponsors, and Her Majesty has kindly offered to be our patron." And I thought, wow, of all those people that I spoke to in that first year who haven't reappeared, Malichaba has done it. Her passion and her commitment has actually made this thing happen. And this is not easy. To register as a UK organisation, as a UK charity, involves an awful lot of jumping through hoops and filling in forms and getting your bank statements organised and lots of different admin. yes, I thought, wow, that is really an impressive thing that she's done during COVID, looking after her family and then making this happen at the same time. One of a very few people who has had that vision and then made it happen. So I was really, really impressed and began to really take notice of what was happening. It is not an easy thing, but you have heard today her passion, her commitment, and I can testify to the dedication that has taken to get this organisation to where it is now. So many congratulations to you, May, and to all those that you have worked with to bring this organisation to this stage where we can be here today for the launch ceremony. You follow, of course, in the footsteps of other organisations that have taken the knowledge and local knowledge of Lesotho and your Basotho heritage and partnered it with other different knowledge that comes from the UK and expertise that comes from the UK and brought that together into an organisation that I believe will really do good things here. In the footsteps of other UK Lesotho organisations such as the Lesotho Wales Foundation, Dolan Cymru, such as Kick for Life, the Lesotho Rugby Academy, the Durham Link, many of these organisations which bring together people from the UK who have a connection here and people from Lesotho to work for good in this country. I think you're the first one that I know where it is a Basotho national who has done this. So I think that's a really positive thing to see happen. Someone from here who's gone to the UK and then come back. And I'm delighted that we've got with us here representatives of the diaspora organisation, because I hope this is something that we will see happen more and more. People bringing back to this country what they've learned, what they've gained, what they've managed to establish in the UK, and coming back to the homeland and being able to give back, because I think that is so important. As the Honourable Minister knows, we went together yesterday to one of the hospitals here in Lesotho, and I saw there so many dedicated health professionals doing all they can to help the people here of Lesotho. But I also saw the gaps that still exist in the healthcare provision that the ministry is able to provide. So despite the dedication of the ministry, despite the dedication of the people working in the health service, there's still so much that needs to be done, and palliative care is one of those areas where there is a lot still to be done. So this is a really timely initiative, an initiative that I believe is really truly needed. All that I want to say is thank you so much. Congratulations for getting to this stage. And I truly believe, I say, with your dedication, with the team you have working with you, and with that, with what we've seen you manage to achieve so far, that you are an inspiration to us and to many people in this country. I wish you so much goodwill in the future. I believe this organisation is really going to go far and really make a difference, and I say that from my heart. I'm sorry that I will not be here in country to see it because I leave at the end of this month, but I will be watching from afar, and I know that my successor, Harry MacDonald, who comes in, will also be there for you to help continue this relationship. So thank you, congratulations, and best wishes for the future. Thank you so much.
Thank you, Her Excellency. We also wish to thank you, Mayor. We know that you had a hand in helping the Starlight Oasis of Hope find trustees in the UK, which was an uphill battle, but you made it possible. We thank you for that. Thank you, Mayor. Thank you. And we want to continue sharing the good things because we want to continue giving hope. Over and above other things, we know we have Sankatana. It's not a fully fledged facility. It's a very low-key facility, but it's giving hand to many Basotho who are already affected by cancer. And we are pleased to announce that through the efforts of the Ministry of Health, now we have our very first own radiation oncologist, a female, Dr. Mputse, and we are very glad it's a big milestone. And over and above that, in our midst, we have Dr. Hassan, who's representing here Dr. Mputse. He also has recently completed his training at the University of Cape Town in palliative care. You can stand up, Nade. All of these efforts and what we are sharing are meant to give hope, for people to be aware that something is happening. We may not see it, but something is happening from all ends, from all corners. Re a leboha. At this juncture, I wish to call upon the Honorable Minister of Health, Ndate Skatle, and while I leave this podium, Ndate, you will assist me in bringing to the podium Her Majesty. Thank you, Ndate. Ke kopa tshwarelo, Ndate.
Ke kopa go hlompha Ntate Motlotlei, nna Motlotlei ke a o hlompha ruri, ke hlomphe moba ba botsei, ke hlomphe Your Excellency High Commissioner, ke hlomphe bohle ba teng kwa. Ruri ke thabo e kgolo ho ba moketeng ona wa ho thakgola tshebetsohadi ena e kgolo. Ha ke santsane ke hola ke ne ke na le ntatemoholo, jwale e ne le lethuela. Jwale o na a fihle lapeng a tsamaye a kgutle, ka tsatsi le leng ebile ntate o teng, o sa re mora ke bontshitswe. Ya ntate o re o bontshitswe o ke bone kgomo ka mona ka sakeng e ke tshwanelang ho e sebedisa hore ke phethele bongaka ba ka. Hele ya ba qabang o ntso tla mo tlo bona dikgomo tsa ka, o ntso tlo bontshwa dikgomo tsa ka ha go tloem. Mme ke shebile nthwena ke a utlwa hore ho thwe ke vision, kore ke pono. Mme re thabile haholo, re a o leboha Ntate Lepheane, goba re utlwile hore ha mme a re o bone pono ha o a etsisa ntate. Re a o leboha ruri. Ho rona mosebetsi ona wa hao mme Lepheane ke thuto, ke mosebetsi o matla haholo. O ka nahana bohloko ba lefu lo tsebang hantle hore le tlo nka. Lena la mofetse lona ke bone batho ha ba kula, mme ha o lakatse hore o kula lefu la mofuta ona. O ka nahana ho oka motho wa mofuta ona. E seng mofetshe fela le mafu a mang, hore na bana batho ba okang na ke bothata bo bokae. Ke utlwile ausi ha a bua mona a bontsha tshepo. O ka nahana hore na ke tshepo e kae eo e tlisang ho Basotho. Ntate Mobishop o buile ka lerato. O ka nahana na ke lerato le le kae le o tla le etsetsa setjhaba sena. Re a leboha ruri. Leboha ntate Lepheane, ke leboha bane ba dulang ka ntle ho Lesotho e le Basotho. Ke a o leboha le wena High Commissioner, o re thusitse haholo. Ke tlhoko e kgolo ena. Ke nnete hore ha e sale ke hola e ntse e etsuwa ke ona masistere. Re qala ho bona Mosotho ya thehang mosebetsi wa mofuta ona. Re a leboha ruri. Le masistere ano e ntse le Basotho, empa ba mokgatlong ka ne re thabile haholo. Her Majesty, we are delighted to receive this precious gift. It is the first time that Mosotho establishes this kind of care. Cancer, in particular, has ravaged this country. We have now learned that every year, at least 500 women are diagnosed as cervical cancer patients. And half of that, 340 of them, die every year in Lesotho. So you can understand how devastating this disease is. It is not only cancer. Today, we have so many people who are suffering from kidney patients. We are barehanded in terms of treating these patients. There are only 4 dialysis machines in Lepheane, and you can understand people suffering from kidneys who come from Mohato, Kachasnik, and spend the whole of their life in Lepheane. We are trying. Indeed, she has mentioned the chemotherapy that we have recently launched. But this is not enough. We are indeed grateful. Lepheane, I repeat, we are grateful We thank you so much. Ka nnete re thabile haholo. Ke tlotla hore o be le pono e se ka le rona re ka ba le dipono ga kgutlela hae jwalo ka ngaka ehlile ngaka ha e bontshitswe e ebe o fihla gona mono mo e bontshitsweng teng re thabile haholo re lebohile.
This is a little present that we wish to pass it into your hands. It is a gift from different people and different organizations who are very much interested in what we are hoping to establish here at home. They have been part of this journey, and they just want to honor you, to have accepted to be the patron for Starlight. And they hope and believe that as they do their best to do fundraising in the UK and advocating for the people of the Kingdom of Lesotho, that indeed palliative care is what we all need here back home, that they will see something happening on the ground, and they are very grateful that you are there to see it through. And please may accept their little blessing to you.
Let me start by paying my respects to the Honorable Minister of Health, Dade Skatle, Your Excellency Mayor Anne, Archbishop Dade Lorotodi, our distinguished guests from the United Kingdom, the President of Starlight Oasis of Hope Hospice, the CEO of Starlight Oasis of Hope Hospice, Lepheane, all distinguished invited guests, Bomme le bontate le lona batjha. It is a great pleasure for me as the patron of Starlight Oasis of Hope Hospice to welcome you to this special occasion that marks the launch of this great initiative. This initiative that is long overdue in Lesotho seeks to stand with patients and their families in the challenges they face in relation to the illness of cancer. Despite the ongoing challenges around communicable diseases, today is a reminder that we as a nation, and indeed as part of the global community, we are still faced with a colossal challenge of non-communicable diseases, such as cancer, that we still have to deal with. It is therefore imperative that we remain united and adopt a concerted approach in addressing these challenges. Cancer is a generic term for a large group of diseases that can affect any part of the body. To put all this into perspective, we need to consider some statistics issued by the World Health Organization in relation to cancer. According to WHO, in 2020, cancer was found to be a leading cause of death worldwide. It kills nearly 10 million people a year and some 70% of those are aged 65 or older. It affects men, women, youth, and children. Lesotho has, over the recent past, experienced a growing burden of cancer. This places an untold strain on our already stretched budget and resources for health services. Promotion of health equity and access to palliative and hospice care services is therefore essential. Access to life-saving cancer diagnosis, treatment, and care needs to be equitable and accessible to all, regardless of where one lives, one's level of income, ethnicity, or gender. Honorable Minister, distinguished ladies and gentlemen, half of the population of the world lacks access to a full range of essential health services. In relation to cancer, many of us are denied basic care, despite the fact that we live in a time of remarkable advancements in cancer prevention, diagnosis, and treatment. This is the equity gap that most regrettably costs lives. People that seek cancer care and treatment encounter barriers in every sphere, be it due to income, education, or geographical location. The equity gap affects everyone, and it is more pronounced in low and middle income countries. In a country such as Lesotho, the equity affects everyone. We therefore take this opportunity to make a clarion call to policymakers and all key stakeholders to pool all resources at our disposal to close the gap. The sad reality is that this gap can translate in real-life situations to the difference between life and death to a patient. There are several ways towards closing the gap that should be embarked upon. We need to improve the general knowledge of Basotho about cancer. We also have a responsibility to improve access to palliative and hospice care services. Collectively, we can reduce inequity by educating the public about cancer prevention, equipping healthcare professionals with skills and knowledge, including on how inequity influences cancer care, strengthening primary health care delivered to communities, addressing, through policy and programs, some of the social and economic factors that can negatively affect people's health, increasing the resources dedicated to cancer care, research, and tracking the burden of cancer nationally to effectively shape health interventions. And lastly, implementing country-specific cancer prevention and control plans that address our unique needs and resources. Distinguished ladies and gentlemen, Today's launch of Starlight Oasis of Hope Hospice in Lesotho truly gives us hope to turn around our fortunes in the battle against this health monster, cancer, whose prevalence is gaining momentum by each passing day. This presents us with an opportunity to commit ourselves and resources to introduce change against this titanic battle. On behalf of the Basotho Nation, I wish to register our profound gratitude to Malichaba, Tebello, Lepheane, and the British community that supported her in a number of ways in this noble endeavor towards. On behalf of the Basotho Nation, I wish to register our profound gratitude to Malichaba, Tebello, Lepheane, and the British community that supported her in a number of ways in this noble endeavor towards effecting change to close the care gap in our healthcare system. This should have the desired impact on diagnosis, treatment, and care of Basotho that suffer from cancer-related illnesses. We are encouraged by the collaboration that we have witnessed between Starlight Oasis of Hope Hospice and our Ministry of Health and other government departments. We believe many more stakeholders will come forward to support this initiative so that patients can have their physical, emotional, social, and spiritual challenges addressed. To patients and their families, let us make the best use of the services that will be offered by Starlight Hospice. We believe Starlight and all related stakeholders will be our hope for better and improved services in your treatment therapy. I, for one, am looking forward to the opening of that center of the Hospice Lepheane. You promised that it will, we're not here just to be talking, launching. We have to do. I love people. I think I can see that already in you, that you are an action-driven lady. So you will do it. It is going to happen, and I'm looking forward to that day when we all go to Maqhaga. But even before that, I would still like to go visit the site to see where it is, and who knows, maybe I'll even participate in construction. I don't know. It is now my singular honor and privilege to declare Starlight Oasis of Hope Hospice officially launched.
Re tla bina pina ya setšhaba, ke kopa ausi o re thusa go phokolela yona. Ke kopa ge mo kadime maike wana o tshwere. O ka bina fela o sena mic. Go ahead.
Lesotho ba tsela bona